If you've ever had a migraine, you know it's more than just a headache. Migraines often involve a concentrated, throbbing head pain, along with blurred vision, nausea, and extreme sensitivity to noise and light. According to a recent USA Today article, roughly 30 million Americans get migraines, with women suffering 3 times more than men. The specialists at Central Florida Pain Management explain the various treatments they offer for migraine sufferers and put to rest the question of who handles pain best, men or women.
Typically, headaches are one of the hardest types of things to diagnose in terms of what type of headache is the patient having. Typically, if we're concerned about what type of headache a patient is experiencing, sometimes we will refer them to a neurologist for further evaluation. We use different types of treatments for different types of headaches. If it's a tension headache, we might use something like trigger point injections and maybe anti-inflammatories or Fioricet. If it is a migraine headache, we might use one of the migraine medications that is available to solely treat migraines, such as Imitrex or Maxalt, and we would typically add in the treatment with Botox as well to try to alleviate the symptoms of the migraine headache.
So Botox is a muscle relaxer. Botox paralyzes muscles. That's the way it works. Botulinum toxin. Tension headaches come from the frowning, all the muscles on the scalp being pulled from anger, tension, neuritis, holding my head like this, all of that produces pain because the muscles are pulling, and after a certain time, after a while, they get tired and they hurt. If you relax them with Botox, the headache goes away for 3 or 4 months. So yes, Botox has found its place in treating headaches through muscle relaxation, muscle paralysis.
By and large, in my experience here, and this is going to be kind of difficult for me to bash my own side of the street, but most of the guys are pretty much weenies about having injections and stuff done. Certainly women that have had experienced childbirth, they're like, that was nothing. I've had several patients that have had surgery, as far as laminectomy surgeries on the back to relieve the pressure on the nerves, and the pain requirements in terms of medications, I would say by and large the women is probably half of what the men require. I really don't have any idea what that would be attributed to. I think it's an observation without really much of a conclusion, I'm afraid.
You'll find contact information and past stories for Central Florida Pain Management when you click the Pain by Gender story link on our homepage at yourhometownhealth.com.